All right. So, good morning. Uh, my name is Joel Payton. I'm the reinsurance program manager for the Oregon Reinsurance Program. This meeting is a state and federal required meeting because this is both a federal grant and a state assessment, and that every year the state has to provide a public meeting for the consumers to allow them to see the type of program that's being run and give them the ability to have public input on the purpose of this program. Again, this program is really based in two parts because this is the Patient Protection and Affordable Care Act, 1332 State Innovation and Empowerment Waiver that the state applies for once every 5 years. And we are in that cycle where the state has to apply again for a waiver for the 2028-2032 program. And we'll discuss that later on within our slide presentation. But so before we get started, we'll just go ahead and start with introductions. And again, I'll start with myself. My name is Joel Payton. I'm the Oregon Reinsurance Program Manager within the Division of Financial Regulation.
So my name is Kirsten Anderson. I'm one of the two deputies here at the Division of Finance. One of my programs includes the reinsurance program and Joel. So.
Thank you. Anyone? Everyone has to. All right, Michael, can you introduce yourself? And I'll just go down the line.
Yes, Michael Sink, Life and Health Actuary for the division. There we go.
All right. Oh, thank you. Let's see, I have a Mary Michelle.
Hi, this is Mary Michelle Sobsny. I'm a legislative fiscal analyst with the Legislative Fiscal Office.
Well, thank you. Jordan.
Yeah, good morning. This is Jordan Mills. I'm an insurance examiner with the division, and I support the program in their auditing activities.
Thank you. Danielle.
Hi, I'm Danielle Marsh. I'm also a financial examiner, and I help Jordan with the audit.
Thank you. And we have Paul.
Hi, I'm Paul Throckmorton, and I am the over the financial analysts and also work with the exam team.
Thank you, Paul. Let's say we have Bo.
Hello, my name is Bo Wright. I'm a government affairs policy analyst with Providence Health Plan and just here to listen in.
Thank you, Bo. Zachary. Is there a Zachary online? They're blocked by yours. Okay. Okay, let's go to Lily. I'm not sure what happened.
Joel, Lily Sobolik here. I'm a senior policy advisor with the Division of Financial Regulation and help support the Oregon Reinsurance Program.
Yes, you do. And thank you so much for your introductions. So yes, so we're going to get started with the program now. Again, like I said before, this division is housed within the Department of Consumer and Business Services, which is Oregon's largest consumer and worker protection and business regulatory agency in the state of Oregon. And we have various divisions and sections within this agency, Building Codes Division, the Division of Financial Regulation, which is a division that the Oregon Reinsurance Program is housed in, Oregon OSHA, Workers' Compensation Division, the Workers' Compensation Board, the Ombuds Office for Oregon Workers, the Small Business Ombudsman, Management and Labor Advisory Committee, Prescription Drug Affordability Board, and Universal Health Plan Governance Board. Now, the agenda for today is that we're going to do the overview of the 1332 waiver that we have here in the state of Oregon, and of course, an overview of the Oregon Reinsurance Program. We're going to talk about the pass-through funding awards that the state does receive, and the status of Oregon's current waiver application for extension. And then at that, we'll ask questions. Sorry, I lost my mouse, sorry. Okay, so the question is, what are Section 1332 waivers? Well, first off, the Patient Protection and Affordable Care Act, the waiver is a federal grant. They come with 5-year term limits, which provides funding for the state of Oregon's Oregon Reinsurance Program, which helps lower costs of the healthcare premiums. And the Affordable Care Act waiver grant operates for this one we currently have through December of 2027. This is the reason why we have to reapply, because the one that expires in 2027, we have to apply for new ones for the next 5 years. And which also, this waiver gives the Department of Consumer and Business Services to apply for these waivers. Now, under the waiver, it has to be, when talking about the waiver itself, the waiver itself has to be as comprehensive and affordable as would be provided absent the waiver. Now these are just some of the guidance that the government gives us when we apply for these waivers, and the guidance is these things would have to be provided in order for us to receive them. Next, it provides coverage to a comparable number of residents of the state as would be provided coverage absent the waiver. And of course, the most important thing, any of these waivers must not increase the federal deficit. Now, as mentioned before, these waivers have a 5-year term limit, and they are approved by the United States Department of Health and Human Services and United States Department of Treasury, and they're managed by the Center for Consumer and Business Services and Insurance Oversight. So that's what these waivers are, and this is the reason why they're so important for the state, because what they actually help provide for the consumers of the state. Now, the guardrails that are set aside for these waivers, which are what has to be provided, is the coverage, affordability, comprehensiveness, and again, deficit neutrality. Now, as mentioned before, these waivers are really important because what they provide, and again, they provide access to quality health care. Again, so as long as this coverage is at least comprehensive as the coverage provided without this waiver. And again, it provides coverage and cost sharing protections against excessive out-of-pocket spending that are at least as affordable as without this waiver. And they provide coverage to at least a comparable number of residents as without the waiver and not increase the federal deficit. So that's what we'll be talking about today, these guardrails and how they ensure that the health care that's being provided in the state meets these requirements. And the principles that really manage this is that our goal is always to provide more affordable private market coverage, encourage sustainable spending growth, foster state innovation, support and empower those in need, and promote consumer-driven healthcare. Now, the Oregon Reinsurance Program is a program that actually uh, manages all these things that we just talked about before. And this ORP ensures that all the guardrails that are required by the federal government are actually carried out. And when they are carried out, this is what actually happens. We're able to stabilize premium rates in the individual health insurance market, uh, reduce the risk of high cost claims for all insurance companies, and expand health plan options throughout the state. Again, the ORP is how Oregon fulfills requirements for the federal ACA waiver, and the purpose of the ORP is to satisfy the requirement of these established guardrails. Now, the overview of the program itself, the ORP began in January of 2018 to help stabilize health insurance market, the lower rates, and expand healthcare services throughout the state. The ORP was created to help health insurance companies by reimbursing a share of the high-cost healthcare claims with the state of Oregon. As a result, healthcare premiums are reduced or even free if you qualify. Now, currently, DCBS has the state authority to operate the Oregon Reinsurance Program through the year of 2032. And that's really based on the state law we have here. The first state law and measure came out in 2018 was HB 2391. And the goal of this was to give us the ability to operate and receive a federal funding from the Centers for Medicare and Medicaid Services. So currently, the law is titled Health HB 2010, which was amended in 2025 to give us the ability to operate this program through December 31st of the year 2032. Now, the federal waiver that we have currently, again, it expires December 31st of the year 2027. So this is really the reason why the department is seeking a 5-year extension to operate the waiver through the year 2032. Now, this is really how it looks like when it comes to the sources of funding for the Oregon Reinsurance Program. We have federal funding or pass-through funding, which we'll talk about later, that actually gets awarded to the state. Of course, after we continue to prove to the feds that we are fulfilling all the obligations of the guardrails and the requirements. And then Oregon's health insurance premium assessment, which is by law through House Bill 2010. And this funding is all put into this one health system fund, it's called. Now, and again, the health system fund is not part of the general fund. It's a fund that's set aside to ensure that, number one, the consumers will continually be able to afford health care, that options are expanded throughout the state for plan options for the consumers, and at the same time ensure that we continue to satisfy the requirements of the federal government. Now, how this really all works is most of the premium assessment that we receive is really made to fund Medicaid. You know, the Oregon Reinsurance Program, we only really attain maybe like 0.03% of any funding, and that funding is only used to help reimburse the high cost healthcare claims for the insurance companies. In cooperation with the funding that we receive from the federal government is how we are able to keep plans affordable, and some of those plans, as I mentioned before, if members qualify, are free and no cost. So the question is, what is the pass-through funding? So when the federal government pays for programs like, it's called premium tax credits, to help people buy health insurance, This is how it works. The state's plan lowers the cost of health insurance. Because health insurance costs less, the federal government spends less money on the ACA premium tax credits, and CMS calculates those federal savings for us after we send them the assumptions parameters, that are calculated through our actuaries for the state. And then once that amount is determined, the savings on the premium tax credits, CMS passes through or gives us the funding, which is the amount of money that they save through this program, and they pass it on to the state. So in actuality, Oregon uses this money to further lower premiums, fund the ORP, and improve access to health care. So this is why this federal pass-through funding is so important, because it really does allow Oregon to continue to offer healthcare plans at reduced rates with the cooperation of the health insurance companies, who we also help pay for the higher cost claims in order to, again, expand more options throughout the state. Now, this is just a look at some of the savings that Oregon has saved Oregonians through the money that we receive. So you hear, and you can see in the year 2022, this is really the second waiver that we started. We saved in that year consumers $112 million. In 2023, the same thing. We saved $103 million. In 2024, we saved our consumers $118 million. In 2025, we are in the process of calculating the total amount of savings. But right now, our budget is really set for 121 million to save. In 2026, we also calculated a budget of $127.7 million of savings. So all these totals here is what consumers are not paying when they incur hospital expenses, and because of that, the consumers are really able to afford health insurance, because the health insurers are being assisted in paying these high cost claims from the state of Oregon and the federal government. Now, this is a parameter set that we use throughout the year, that is set by our actuaries, and this is really for a model for the insurance companies when they receive healthcare claims from the consumers. And just take, for example, in 2022, any consumer who reached a total of $92,000 in healthcare claims, that's the trigger point for the state and the federal government to help pay that cost. And the maximum cost goes up to $1 million. And the coinsurance rate is the amount that we are actually sharing with the health insurance company to pay. So for this year, for 2025, that attachment point is that any consumer reaches $103,000 in healthcare claims. Again, that triggers that assistance and funding to help the insurance companies pay down those high cost claims. And again, when you do that, we're helping the insurance companies. They're helping the consumers by keeping their premium rates lower than they would be without the ORP or the waiver. And this is really a graph of how this all works. As you can see here, as we scroll through the graph, as I mentioned, when a patient's care is covered by reinsurance eligible plan, the insurer will cover the cost up to the specified amount and which I stated before, that one amount was 92,000. For this year is 103, and once that plant is triggered, uh, that's when the estate helps the insurance companies pay for these high cost claims. And in essence, when all that's done, uh, we are able to keep the rates low and help the insurance companies stay sustainable. Now, because of all of that I spoke of earlier, for this year and for many years, we were able to have many healthcare plans throughout the state. You see, when the insurance companies are getting assistance and paying down high cost claims, they're able to expand their footprint throughout the state to give consumers more options. As you can see here in this graph here, the state graph map, currently for this year, we had up to 5 to 6 different health plan options throughout the entire state. And when this occurs, again, this gives consumers more options on uh, on their healthcare servicer throughout the state. So this is really the benefit of both the waiver and the reinsurance program. In addition, this program also supports consumer health care by having comprehensive plans. Within the Oregon Health Insurance marketplace, these plans offer uh, things like ambulatory services, emergency services, hospitalizations, maternity and newborn care, mental health and substance abuse disorder services, including behavioral health treatment, prescription drugs, rehabilitative services and devices, lab services, preventative and wellness services, and chronic disease management, pediatric services, including oral and vision care. So, because of this program, because of the assistance from the federal government, uh, because of the state law that helps fund the program itself, not only does it expand the footprint of services, but also offers comprehensive plans for consumers so they can make healthcare affordable for themselves and their families. And because of that, you can see this is really a graph of the enrollment uh, uh, on the health insurance marketplace, both on and off the exchange, and of course, ACA compliant plans totally combined. And as you probably looking at this graph, you see, well, in 2022, we had like 170, we averaged, these are average numbers, 176,000 members on and within the marketplace, but now we're down to 139,000 in 2026. Well, again, that's just because of movement and different programs being turned on. But at the same time, with the way the enrollment still flows, the plans are still affordable. The services, the exchanges are still out there helping our consumers acquire the type of health care they need. And one of the things I can really speak for 2026, you can see those two little footnote stars on the bottom. There was a law that came into effect in 2022, House Bill 4035, which was it's called the Benefit Health Plan, or some call it the Bridge. And what this does too, again, it further allows consumers to have more options on affordable health care. Uh, uh, there was there was a percentage of the consumers uh, that fell between this uh, 138 to 200% federal poverty level, again, which gave them the ability to acquire the health care. Now, it doesn't really serve any huge impact to the Oregon Reinsurance Program, because our goal is to service the consumers and provide health care at affordable rates. That's always been the goal, and that goal is still going on. And the program itself is just successful when it comes to that. But yeah, our goals are always to provide the necessary services and affordability for our consumers. So. Now, this federal waiver extension, I'm just going to spend just a little bit more time on this because this, again, this happens every 5 years. And as a state, we started this process last year by sending a letter of intent to the Center for Medicare and Medicaid Services, the Department of Health and Human Services, and the United States Treasury. And that's order gives CMS the ability to tell Oregon that they have run their program in the past applicable to all the guardrails that we mentioned before. So once they see that Oregon has done that in the past, they give us the ability to reapply again for another 5 years. And just through that process, what we have done within that is, especially this is one of the obligations here, is to have this public meeting to inform consumers about the funding streams and programs that the both federal and state government have to benefit the consumers. So we did that. This is one of them right here. One of the public input measures that they require. We also had one earlier we had an opportunity earlier back in October of last year to give a brief presentation to the tribal communities here in Oregon, which was it was a very good meeting and allowed those consumers to learn more about what this program really does. And then, and as it went on, we reach out to industry and consumers alike to ask for public input. And again, this meeting as well is going to ask for your input, because CMS wants to know what the consumers think about these programs, and that's why they have these, to get your input on how well that you think these programs are working for you. Now, moving further on, this waiver application that we're applying for, where we are right now is that we're at they call it the actuarial assumption stage, which means the actuaries, both state and contracted, are putting together an analysis to inform CMS about what our assumptions are for the next 5 years. And once that is completed, that's when we're able to wrap up this application and have it submitted at the latest by November of 2026 this year. And once that's done, it usually takes maybe a 90-day process, as I have listed here, or more, for CMS to respond to the notice of completion, for CMS to review the application that we had sent, for CMS to post this application on the Federal Register for a 30-day public comment period. And then once all that's done, that's when we may hear back around early spring of 2027 that the application was approved for another 5 years. So these are some of the things that we go through, and we've been through this our third time going through this, and we've all been pretty successful. And with that, our main goal, like was stated before, is to fulfill those guardrails for the federal government, and also for the state, continue to apply to the law that was established or was amended back in 2025, House Bill 2010, to ensure that that our consumers will keep receiving the services at low cost with planned options within their areas in order for them to take care of their health care needs. Okay. We are at the end. Are there any questions? No questions? One? Can I get one question? No, I'm just kidding. No, thank you all. Well, if there's no questions, again, I want to thank you all for attending this federal and state required meeting for the Patient Protection and Affordable Care Act 1332 waiver and the Oregon Reinsurance Program. Again, this is a public input meeting, so we do have a public comment time period that's open from now through August the 10th of 2026. If you would like to respond or ask any questions or have any suggestions for CMS, all of your suggestions and questions will be forwarded to CMS and the departments once this application is submitted. So again, thank you all again for attending. If you have any questions, please reach out to me. If you have any comments, please email them directly to me. And if that's all, that is the end of the meeting. Thank you all for attending.
Thank you, Joel.
Okay,
Thank
you're
you.
welcome. Okay, you're welcome. Thank you.